Hello everyone, today we are here with Dr. Pham, a pharmacist at AllCare Pharmacy. Dr. Pham?
Hi, my name is Mary Pham. How are you guys today?
Alright, so we're just going to ask you a few questions here today, but just to start off, what changes in healthcare or pharmacy do you think will most impact independent pharmacies over the next 10 years?
I'm an independent pharmacy owner for the past 6 years. I've been a pharmacist for 26 years now. Graduated from University of Southern California. I actually love what I do. I love being a pharmacist. There's just so many changes in pharmacy for sure. I think that the profession of pharmacy itself is a great profession. There's so many industries. There's retail pharmacy, which you guys typically know is like CVS and Walgreens. There's hospital pharmacy, which I worked for over 10 years. I worked for the Children's Hospital of Orange County for 10 years. I've also worked in long-term care for the elderly. There's pharmaceutical industries that manufacture drugs, and then I'm now a pharmacy owner. I own my own independent pharmacy, but while I'm here, I also have a consulting business. So I actually am a healthcare consultant, and I have about 5 clients that I work out of this office as well. But the whole independent pharmacy, it's really sad, but a lot of owners are being what we call there's just a low reimbursement rate. The cost of drugs is just so high, and it's hard to compete with the big businesses like CVS and Walgreens. They drive a lot of the pricing down. They get much better pricing on drugs, and so and then just the cost of like staffing. Healthcare professionals are pretty. The good thing is we get paid well. The bad thing is it's a high expense. But overall, I think just the major impact is just online pharmacies now. Everyone's shipping. We do that too. There's not a lot of face-to-face even in pharmacy now, and so that changes the industry a lot. But you won't see a lot of independent family-owned pharmacies anymore, just because everything is it's going to be behind a screen, and what's really easy, people won't walk in to a mom and pop shop anymore, which is unfortunate, because I love going in and seeing people in person and having the hands-on, that's healthcare. Like, you take care of people, you work hands-on, but our younger generations like everything on the screen. So, and that's okay, but that's the major changes in impact, and we have to just work with that.
Yeah, I think this shift in technology has really kind of changed what it means to like these like tiny in-person interactions that you have. Even in healthcare, I think it's really changed how people interact.
Yeah, they're okay with doing a Zoom call and having a visit and just talking to us. We text everything now to our patients. They want to text when their drug's ready or what the doctor calls in. They'd rather have a text than a phone call.
One question I have for you is, were you always interested in pharmacy, or was there any other fields you were interested in science, or like were you ever wanting to become a scientist even maybe?
I've always been interested in science, but my first love was I actually was really interested in engineering, and so I looked at doing actually environmental engineering. So I actually had an internship at a mobile oil and did an environmental internship, but then I realized I went on shadowed environmental engineer, and I was like, all they did every day was just go to the field, and it was just dirt and things, and I was like, I really miss people, and so I felt like, okay, that shows me that I really like the human side of everything, and then that's what kind of guided me back to healthcare, and that I do like helping people, and the human touch for me was really important, and so then I went back. Those were kind of my two, was it pharmacy, or I wanted to be an OB-GYN possibly, healthcare or engineering, and that really so I like that what you guys are doing is having that hands-on experience really makes you know what you want to do, not what you think you want to do, right?
Yeah, pharmacy includes a lot of the human interaction and
yeah, the goods and the bads. You can have people really happy that they're doing well, and then they're really upset if the drug doesn't work. So.
Okay, what are the biggest misconceptions people have about pharmacists and what they actually do?
I think it's what you see in commercial people joke around is that they just think we're pill counters. We just think we count by fives every single day. And the new misconception is because now we have machines that count it, right? So you could pour it in and it counts it. So now they think that all we do is verify because everything is barcoded now with technology. So I think now the misconception is not just the pill counting, it's moved away from that to just, all they do is scan to make sure that that barcode matches, and then they move it on, and they don't do anything clinical. But in our practice here at our pharmacy, we're very clinical. We work with the doctors directly. Dr. Reddy preferred this because we talk to her on like every couple of days a week, and the hardest thing about medication now is like it's dictated by insurance, and most of it is they don't want to cover the high cost drugs. So what we do is we make recommendations based on what the patient's insurance is, what their diagnosis is, what their other drugs that they're on for drug interactions, price, because a lot of the patients can't afford some of the high cost drugs. So we look at all of that and give the best recommendation and make sure that at the end of the day that the patient has access to treatment so that they can get treated and get better, right, for the disease states. So I think that, pharmacy is a lot more than just counting pills and verifying barcodes, and it's a lot more in different industries too. Like I just talked to a pharmacist who is in managed care, and she takes care of all the drugs that has to be on the formulary for the plan, because on the insurance plan, they want to save the most money, right, to make sure that they're profitable. They don't want to just approve high-cost drugs. So they have a pharmacist that's called an MSO pharmacist, Managed Service Organization, and she looks at what are the drugs that they'll pay for, but will still make sure that the patient will be treated for that disease. So there's a lot of things a pharmacist can do with our education. We have to do chemistry, biology, pharmacokinetics. It's a 3 to 4 year education for a doctorate degree, and we should be able to use that for clinical skills, right?
Yeah, that's really cool. I think it's unfortunate that you guys are always like pigeonholed into this one specific role of verifying. I think it's really cool that you guys really do a lot more than I guess a lot of people think. I think it's really cool that you guys do have so many roles.
Thank you.
Just to move on. How has the role of pharmacist first evolved since you entered the field?
Oh yeah, it's evolved a lot. I think when I graduated in the year 2000, and it's now 2026, I think it was very fragmented. I think we were stuck in our different industries. Like if you're a compounding pharmacist, all you did was work in a compounding pharmacy. If you're a retail pharmacist, if you're a hospital, like we were very just fragmented in our own. And now I think it's a lot of consolidation. I think like all of us have to know how to do one thing. And even pharmacy schools, their education is that they're trained to do, they have a compounding class, they do have managed care rotations, they do have pharmaceutical rotations, retail. So they're in different industries, but I think now it's like we're expected to know how to do all of it now. And my coworker is working for actually Lawns, and so she has to give vaccinations, do a clinical assessment so they can get the extra bonus dollars from third party, and still verify and still give consultations. And so they don't just barcode scan anymore, they have to do all of that, even in retail. So you're expected to do everything.
Do you think that's a positive change since 2000, or?
Oh yeah, I think it's definitely a positive change, because a lot of my colleagues who've just done one thing, it's hard for them to find jobs, and it doesn't make it really like limited their skills, for the future. So I think it's best like now you come out and you're fully you have a full skill set, so that as far as job market and just professional wise, you get to use everything that you learned, and then you can also be hireable, in the future. Yeah.
Just kind of move on. What kinds of patient interactions have stayed with you most throughout your career?
I think that's what differentiates here. Like, I actually know almost all of my patients, especially like the first few. I hand deliver medication to their home in an emergency. We have 24 hours, 7 on-call service here. And so I think, you know, you just even, I think just yesterday I had a text from a patient that he had to, because of his insurance, he had to mail his injection to another pharmacy. So he hasn't been with us since 24, and so he had a hard time getting it approved and started getting his weight back. His diabetes started coming back. His levels were going up again with his diabetic levels because he was actually under control. And he said, I want to change to tablets because I want to go back to you guys. I missed you guys when I was with you for 4 years. I was under control. My weight was great. I was really happy. And he said he just really missed our communications with our pharmacy. So we were able to change his medication to an oral tablet that's long acting. If there's long acting tablets now, which is great for people who are afraid of needles, that he can take every 3 to 5 days. We did the prior auth, and now he's back with us, and he's so happy. You know, so I think that makes me happy that, like, when they're forced to go somewhere else and they really want that choice to come back to us, they're willing. Like, he was willing to make a change just because he knew, like, that's what it took. So I think that's like having a good pharmacy and patient relationship. It's great.
Just making that unique connection.
Yeah, and seeing that we made a difference with them, and even though they were forced to go somewhere else by insurance, they still made, like, the patient made the effort to come back to us, right? So yeah, which is good.
Yeah, that's really cool. I think I feel like now it's really common to see, like, especially now that in-person interactions have changed. I think it's really cool that you guys have forgotten that healthcare is a lot of healthcare is just communicating with the patient, and I think it's really cool that you guys allowed, like, have the patients come back to you. I think it just really shows that healthcare really is just based in just proper communication. So that's really cool.
Thank you.
Okay, well, I think we're just about wrapped up here. Thank you, Dr. Pham, for taking your time for us to interview you. We really appreciate it.
Yeah, thank you so much.
All the best. You guys are doing a great job.
Hey everyone, thank you for watching our video. For more information, check out the link in the description at healinghandsmentorship.org. Click the link down below for our student interest form, or click here for more videos.